If you are between 70 and 80 years old and have to go to the bathroom a lot at night, important advice for older people. Do you ever feel lost or worried about your health when you wake up at night? The sad story of Mr. Liam shows how a seemingly normal trip to the bathroom can turn into a life-threatening event. It also shows how important sleep is for health problems, especially in older adults. We'll talk about some of the most important things that affect sleep in this video, such as changes in mood, diet, health conditions, and the environment. Read all the way to the end to find out useful and important strategies that can help you or someone you care about sleep better and feel better overall. Do not miss out on important ideas that could change your life in a big way. Before we begin, there's something special I want to give you near the end of this video, a quiet little tip that's made a big difference in my own life. I hope you'll stay with me all the way through. Please take a moment to like, subscribe, and press the notification bell so you don't miss any of our future moments together. And if you're watching right now, say hello by commenting, "Still growing, still glowing." It's always heartwarming to see who's with us. It's time to begin. 70-year-old Mr. Liam had been troubled by the quality of his sleep for a long time. He often found himself waking up several times at night and having a hard time falling asleep again. One night, he woke up and had to go to the bathroom right away. After going to the bathroom, Mr. Liam felt a sudden wave of pain. It was impossible for him to stop his heart from beating fast, and he felt dizzy all over. He tried to stand up, but no matter how hard he tried, he fell down. The noise woke up his family, who quickly rushed him to the closest hospital because they were scared. Even though the medical staff did everything they could, Mr. Liam tragically died of an unexpected illness. His untimely death broke the hearts of his family and caused a lot of worry and talk in the community. How could something so simple like going to the bathroom have such terrible and tragic consequences? Was a question that the incident brought up. Anxiety and depression are common things that wake people up at night. As we get older, the quality of our sleep becomes even more important to our health and well-being. On the other hand, a lot of older adults have trouble sleeping and often find themselves waking up several times during the night. A lot of recent research has shown how big of an effect changes in mood can have on sleep. When our feelings and moods change, these are called emotional fluctuations. They can make it very hard to sleep. For instance, feeling strong emotions like happiness, anger, or sadness right before bed can stop your body's natural sleep cycle. When these strong emotions happen, they cause nervous tension in the brain, which makes it harder for the brain to relax. Imagine what would happen if you watched an exciting TV show or heard some bad news right before bed. These kinds of things can make you feel very strong and keep your mind busy and alert. When the brain is active and tense, it has a hard time relaxing, which makes it hard to sleep. Taking care of these feelings before bedtime is especially important for older adults. Over time, our sleep patterns change, which can make it harder to get the restorative sleep you need. When you add emotional stress to the mix, it can make sleep problems even worse. To improve the quality of your sleep, a relaxing bedtime routine can be very helpful. Take a look at these strategies. 1. Don't get too excited. Avoid doing things that will wake you up, like watching scary movies or TV shows before bed. Choose activities that will help you relax instead, like reading a book or listening to soft music. 2. Deal with stress. Relaxation techniques should be a part of your evening routine. Deep breathing, meditation, and light stretching are all good ways to calm your mind and get your body ready for a good night's sleep. 3. Make a place where you can relax. Turn your bedroom into a peaceful place to relax. Make sure the room is cool, dark, and quiet. You could use blackout curtains or a white noise machine to make a room that is good for sleep, or a regular routine. Set a regular sleep schedule and stick to it. Your body's internal clock can be more stable if you go to bed and wake up at the same time every day. This can help you fall asleep and stay asleep. Understanding and controlling our mood swings can make a big difference in how well we sleep and our overall health. Having a calm and peaceful mind is important for getting a good night's sleep. And food choices. Your diet is very important for sleep quality, and what you eat, especially in the hours before bed, can have a big effect on how well you sleep. For some people, eating big meals or drinking a lot of liquids right before bed can stop their bodies from naturally winding down. If you eat a big meal or drink a lot of water right before bed, your digestive system stays busy when it should be getting ready for sleep. This can slow down your digestion and make it hard for your body to calm down. For some people, this can cause severe stomach pain, bloating, and other digestive problems that make it hard to sleep. These kinds of discomforts can wake you up many times at night, making it hard to get a good night's sleep while staying asleep. Some kinds of food, especially greasy and spicy ones, are known to be very bad for you. Spicy foods can taste good, but they can make your stomach hurt and lead to heartburn or acid reflux. People who have these conditions often wake up at night because they hurt and can wake you up, but it's harder for the digestive system to break down foods that are oily. The high fat content can make you feel full and uncomfortable, which can make it even harder to sleep. If older people want to improve the quality of their sleep, they need to pay close attention to what they eat. Here are some useful suggestions to think about. 1. Don't eat big meals right before bed. If possible, try to eat your last big meal at least 3 hours before bed. So, your body has enough time to process and digest the food properly, which makes it less likely that you'll be uncomfortable at night. 2. Don't eat greasy or spicy foods late at night. If you eat these foods earlier in the day, your body has more time to process them, which means they won't affect your sleep as much. 3. Watch how much water you drink. It's important to stay hydrated, but drinking a lot of water right before bed can make you wake up many times at night to go to the bathroom, which can make it hard to sleep. You can let me know you are still watching this video by leaving the first comment below. If you like these stories, please do so. Causes of disease. Health problems that are common in older adults can also make you wake up a lot at night. For instance, health problems like kidney issues, diabetes, and prostate issues in men can make it hard to sleep. Blood sugar levels that go up and down can make it hard to sleep for people with diabetes. These changes can affect how well the kidneys work, especially the glomeruli, which are small filters in the kidneys. When blood sugar levels aren't stable, you may have to go to the bathroom more often, especially at night. Men who have problems with their prostates, like benign prostatic hyperplasia, BPH, often wake up in the middle of the night. Men's prostate glands can get bigger with age, putting pressure on the bladder and urethra. This can make it hard to completely empty the bladder, which can cause frequent urges to go to the bathroom, even at night. Sleep apnea. Sleep apnea is a serious sleep disorder that affects a lot of older people. People with this disorder stop breathing sometimes while they sleep. Apneas are the medical name for these pauses, which can happen several times an hour and last anywhere from a few seconds to a few minutes. Obstructive sleep apnea, OSA, in which the airway gets blocked while you sleep, is the most common type. One of the main problems with sleep apnea is that it causes people to wake up a lot during the night. The sleep cycle can be seriously messed up by these awakenings, even if they are short and not remembered. This wake-up call keeps the person from getting to the deep, healing stages of sleep. People who have sleep apnea often feel tired all the time, which can make it hard to stay alert and focused during the day. This tiredness can make it hard to focus on daily tasks, do well at work, and do other things. Older people may also be more likely to fall and get hurt because they are less alert. A person with sleep apnea is also more likely to have serious health problems like heart disease, stroke, or high blood pressure. Repeatedly pausing to breathe lowers the amount of oxygen in the blood, which puts extra stress on the heart and lungs. In the long run, This stress can be very bad for your health. Sleep apnea can be helped though. Making changes to your lifestyle, like quitting smoking, losing weight, and sleeping on your side can make a big difference. You can use a CPAP, continuous positive airway pressure, machine, or other medical treatments to help keep your airway open while you sleep. If you think you might have sleep apnea, you should see a doctor right away. Early diagnosis and the right treatment can make sleep and health in general a lot better. RLS stands for restless leg syndrome. A neurological disorder called restless leg syndrome, RLS, makes people want to move their legs all the time, often without being able to. People who have this urge often feel various uncomfortable sensations in their legs, which they often describe as tingling, itching, or like having pins and needles in them. The strength of these feelings can range a lot, from being mildly annoying to being very painful. The strongest feelings of these things happen when you're resting or trying to sleep, which can make it very hard to fall asleep or stay asleep all night. Because of this, people with RLS often feel tired during the day, and their quality of life seems to be getting worse overall. RLS can happen to people of any age, but older adults are more likely to have it. The exact cause of RLS is still not clear, but many people think it has something to do with problems in the brain chemical dopamine. Dopamine is a key chemical that controls muscle movement. If there are problems with dopamine levels or function, they can make RLS symptoms worse. Long periods of sitting or lying down, high levels of stress, and not getting enough sleep are just a few of the things that can make RLS worse. Some medicines and underlying health problems, like kidney disease or diabetes, can also make RLS symptoms worse. Additionally, there is evidence that RLS may be linked to genes. As the condition runs more commonly in some families, RLS may be genetic, as it runs in some families. Managing RLS usually starts with making changes to how you live, getting regular exercise, eating well, and following good sleep hygiene can help a lot with eliminating symptoms. Also, you should stay away from caffeine and alcohol because they can make your RLS symptoms worse. Some people may need to take medicine to effectively manage their condition in more severe cases. There are many ways to help manage the symptoms of RLS, even though living with it can be hard at times. Should you think you might have RLS, you should talk to your doctor right away. They can help you make a personalized treatment plan that will help you sleep better and feel better all around. Alcohol and coffee. When drunk in the evening, both caffeine and alcohol can make it very hard to sleep, which can cause a number of health problems. Caffeine, a well-known stimulant that can be found in coffee, tea, chocolate, and many soft drinks, makes it hard for the body to fall asleep. It does this by blocking adenosine, a chemical in the brain that helps you sleep. The effects of caffeine can last for hours, which can make it hard to fall asleep and stay asleep all night. For older people, who may be more sensitive to caffeine's effects, even a cup of coffee in the afternoon can make it hard to fall asleep and stay asleep at night. Limiting your caffeine intake, especially afternoon, can make your sleep much better. Alcohol, on the other hand, is known as a depressant. It may make you sleepy at first and help you fall asleep faster, but it also changes the natural sleep cycle. A lot of people who drink alcohol don't get as much REM sleep, which is the most restorative stage of the sleep cycle. This decrease in REM sleep makes sleep lighter and less restful. Also, drinking can make you wake up more often at night, which lowers the quality of your sleep even more. When older people drink alcohol and caffeine together, it can make sleep problems worse and raise the risk of health problems related to sleep. So, cutting down on both of these substances, especially in the evening, can help you sleep better and be healthier overall. An appropriate place to sleep and a bedroom. Setting up an environment that is good for sleep is important for getting restful, uninterrupted sleep. When it comes to falling asleep and staying asleep all night, an uncomfortable bedroom environment can really get in the way. The quality of your sleep depends on many different factors, and addressing these factors can really help. If you are still watching this video with me and think these stories are helpful, please let me know in the second comment below. The mattress is one of the most important parts. If your mattress is too firm or too soft, it can make you uncomfortable and wake you up often. The best mattress should support your spine well and follow the natural curves of your body, keeping you in the right position while you sleep. A mattress that doesn't support your body can make pain worse and make it harder to sleep. Along with the quality of the mattress, noises that wake you up can really make it hard to get a good night's sleep. Even sounds that don't seem important, like faraway traffic, the hum of an appliance, or a ticking clock, can wake you up and keep you from getting to deeper, more restful stages of sleep. You could use earplugs, a white noise machine, or even background soothing sounds to block out these noises and make your bedroom a more peaceful place to sleep. Light exposure is another important factor that affects the quality of sleep. Exposure to light, especially from screens, can mess up the production of melatonin, a hormone that controls when you sleep and wake up. In the evening, melatonin helps your body know it's time to go to sleep. It's best to turn down the lights and avoid screens at least an hour before bed to help your body make its own melatonin. Making sure your bedroom is as dark, quiet, and comfortable as possible will help you sleep better and feel more rested overall. No medicines. As a side effect, or because they interact with other drugs, some medicines can make it hard to sleep. Antidepressants, blood pressure medicines, and some antihistamines are often to blame. It can be hard to fall asleep and stay asleep when you're taking antidepressants, especially ones that make you feel more alert. Medications for high blood pressure can cause problems like having to go to the bathroom a lot or blood flow changes that can make it hard to sleep. Antihistamines are often prescribed to help with allergy symptoms, but they can also make you sleepy, which can make you sleep less and feel sleepy during the day. It's important to talk to your doctor about any sleep problems you're having. They can help you determine if your meds are causing sleep issues and suggest other treatments. You can deal with these problems and find solutions that are better for your overall health and sleep health if you work closely with your healthcare provider. Things related to psychology. Mental health issues like anxiety and depression can have a big effect on how well you sleep. Anxiety can make your mind race, make you antsy, and make it hard to fall asleep. Worrying about everyday things, your health, or things that might happen in the future can keep your mind alert, making it hard to relax and fall asleep. On the other hand, depression often messes up sleep patterns, making people either unable to sleep or too sleepy to function. Depression can make it hard to sleep, which can keep you from getting the rest you need, making you more tired and hurting your overall health. Anxiety and depression can both make it hard to sleep, which can hurt your mental health. This is why it's important to get help from mental health professionals. Going to therapy, practicing stress reduction techniques like meditation or mindfulness, and dealing with these mental issues can help you deal with and lessen their effect on your sleep. You can improve the quality of your sleep and your life in general by taking steps to deal with mental health issues. The third comment below lets me know that you are still watching this video with me. If you find these stories helpful, please let me know. In conclusion, the story of Mr. Liam is a moving reminder of how complicated sleep problems can be, especially for older adults. As this shows, it is very important to deal with many things that can affect sleep quality. People can greatly improve their sleep quality and overall health by taking a comprehensive approach that includes understanding and managing mood swings, taking into account the effects of diet, treating underlying health conditions, and making their environment more conducive to sleep. Emotional changes like stress, anxiety, and depression can make it very hard to sleep. People can lessen the effect these emotional factors have on their sleep by recognizing them and dealing with them through therapy and stress management techniques. Dietary factors are also very important. For better sleep, Eat a balanced diet and stay away from stimulants like caffeine and big meals right before bed. Taking care of your nutrition can help your body's natural sleep cycles and your health in general. Careful management is needed for underlying health conditions like long-term illnesses or medication side effects. Talking to your healthcare provider on a regular basis to go over your treatment plan and make any necessary changes can help with sleep problems caused by these conditions. Creating a good sleep environment by making sure you have a supportive mattress, reducing noise and light, and starting a relaxing routine before bed can also greatly improve sleep quality. To prevent sleep problems and improve quality of life, it's important to get regular checks and care. When people make these habits a part of their daily lives, they can sleep better and live a healthier, happier life afterwards. Thank you for spending this time with us. If this video brought you comfort or clarity, we'd be honored if you'd subscribe and ring the bell to stay close to our community. And if you're feeling inspired today, type in the comments, "I'm still blooming." It's a simple phrase, but one that reminds the universe and ourselves that growth doesn't stop with age. In fact, it deepens. Take care and remember, your light is needed in this world. Taking care of your nutrition can help your body's natural sleep cycles and your health in general. Careful management is needed for underlying health conditions like long-term illnesses or medication side effects. Talking to your healthcare provider on a regular basis to go over your treatment plan and make any necessary changes can help with sleep problems caused by these conditions. Creating a good sleep environment by making sure you have a supportive mattress, reducing noise and light, and starting a relaxing routine before bed can also greatly improve sleep quality. To prevent sleep problems and improve quality of life, it's important to get regular checks and care. When people make these habits a part of their daily lives, they can sleep better and live a healthier, happier life afterwards. Thank you for spending this time with us. If this video brought you comfort or clarity, we'd be honored if you'd subscribe and ring the bell to stay close to our community. And if you're feeling inspired today, type in the comments, "I'm still blooming." It's a simple phrase, but one that reminds the universe and ourselves that growth doesn't stop with age. In fact, it deepens. Take care and remember, your light is needed in this world.